Insulin was introduced as a treatment for diabetes in 1922. The drug has helped control blood sugar levels for patients with diabetes for over 100 years. Many patients have misconceptions about insulin's effects on kidneys and the need for dialysis. Some are afraid of needles, and some believe insulin injections are the end of the journey for diabetics. Why do some patients need insulin injections? Do you still remember the previous video about the traffic light system? Diabetes patients whose HbA1c percentage falls in the category of yellow or red color will require insulin injections prescribed by doctors based on their blood sugar control, especially when the patients are having poor blood sugar control or when they are pregnant. If you don't take insulin injections when you are supposed to, you have uncontrolled blood sugar levels, and in the long run, these will damage your organs. Insulin is typically associated with weight gain and hypoglycemia side effects. Therefore, you should take it as prescribed and monitor your blood sugar level at home on a regular basis. Different types of insulin vary in appearance, either appearing as a colorless or cloudy solution, how fast and how long it works in your body. These help to determine when the insulin needs to be injected. The injection timing of insulin is very important to ensure it is effective. The most commonly used insulins are these yellow, green and brown color cartridge insulins. These yellow cartridge insulins is called Atripit or Insugen R. It is a short-acting insulin which is faster in action, but the duration of stay in the body is much shorter. It appears as a colorless solution. It takes around 30 minutes to start working in your body. Thus, it should be injected 30 minutes before the 3 main meals of the day. The green color cartridge insulin is known as Insulatard or Insugen N. It is moderate in action but can last longer in the body. It is a cloudy solution and should be injected at bedtime. The brown color cartridge insulin is called Mixtard or Insugen 3070. It is a mixture of two types of insulin, namely Atripit and Insulatard or Insugen R and Insugen N. It appears as a cloudy solution. It is advisable to be injected 30 minutes before breakfast and dinner. We also have a newer version of insulin called insulin analog, which is associated with a much lesser risk of hypoglycemia, which is very low blood sugar level. This orange cartridge insulin is a rapid-acting insulin. It is known as Novorapid. It is a colorless solution. It works faster than Atripit. It starts working in your body less than 20 minutes after injection. Thus, Novorapid is advised to be injected 5 to 15 minutes before meals or immediately after meals. Long-acting insulin like Basalog in the light blue color cartridge, Levemir in the green color cartridge, and Lantus in the purple color cartridge are all colorless solutions. They take 1 hour after injection to start working in your body, but they can last up to 24 hours in your body. They can help to control blood sugar levels in between meals and while you are sleeping. Long-acting insulin can be injected at any time of the day, as long as at the same time every day. Novomix is the pre-mixed insulin consisting of rapid-acting insulin and intermediate-acting insulin. It takes less than 20 minutes after injections to start working in your body. Hence, it is to be injected 5 to 15 minutes before meals. Rhizodec is the premixed insulin consisting of rapid-acting insulin together with ultra-long-acting insulin. It takes less than 20 minutes after injection to start working but can last up to 40 hours in your body. It needs to be injected 5 to 15 minutes before meals. The choice of insulin regime is individualized. Some patients will need only one type of insulin or more. Some patients will need a combination of insulin plus oral anti-diabetic medications. Doctor will prescribe accordingly based on the patient's blood glucose control, dietary pattern, and lifestyle. Always take your injection and oral anti-diabetic medications on time, according to the doctor's and pharmacist's instructions. Never stop, increase or reduce the dose of medications without the doctor's knowledge. Most importantly, do remember to consult a doctor if you have any doubts or experience prolonged side effects. Insulin and glucagon are the two hormones that work together to regulate the blood sugar level. Apart from insulin, there are other injectables such as azizinotide, lisozonotide, liraglutide, dulaglutide, and semaglutide. These injections work by stimulating your pancreas to produce more insulin and suppress glucagon production. The blood sugar level will drop when more insulin is produced and less glucagon is released. These injections also help to reduce appetite and body weight. These injections can be given either daily or weekly, depending on your prescribed type. Isosonatide can be injected either 2 times a day or once weekly. Liraglutide and lisosonatide can be injected once daily, while dulaglutide, semaglutide can be injected once weekly. Isosonatide twice daily dosing should be injected 60 minutes before main meals. And lisosonatide once daily dosing needs to be injected 60 minutes before any meal. While liraglutide once daily dosing, isosonatide, dulaglutide, and semaglutide once weekly dosing can be injected at any time without regard to the meal. The common side effects are nausea, vomiting, and diarrhea.
How do you store your insulin cartridge? Store the new unopened insulin cartridge in the middle compartment of the fridge, not at the door side of the fridge. Don't put it inside the freezer. The insulin cartridge, which is in use and inside the insulin pen, can be kept at room temperature, and it usually can last for 28 days. Are you injecting your insulin correctly? Well, proper injection technique is important to ensure that insulin is delivered to subcutaneous tissue, which is the tissue under the skin, but not within the skin, intradermal, or muscles, intramuscular. Insulin is available in different formulations such as pen fills and vials. Pen fills are commonly used device for the administration of insulin. This picture shows the components of pen devices and insulin needles. Some pens are disposable, need not to be assembled before use, while others have replaceable insulin cartridge that needs to be inserted. The common injection sites are the abdomen, which is a preferred site, thigh, buttocks, and arm. You are advised to regularly rotate the insulin injection site within the same body part. For example, if you choose abdomen for the injection, rotate the site of injection regularly within the abdomen. Try not to change the injection part of the body too frequently, as different body parts have different absorption rates. You should rotate the injection site between 2 fingers width away from the previous injection site. A step-by-step guideline for insulin injections. First, make sure you wash your hands with soap before handling insulin pen devices. For cloudy insulin such as Insulatard, Insugen N, Mixtard, and Novomix, tip up and down for 10 cycles to ensure insulin has been resuspended into a consistently milky white appearance. Check if the insulin is evenly mixed after tipping it. Do not shake the insulin pen too vigorously, as it could damage the insulin. You must roll cold insulin between your palms 10 times like this. For an insulin pen with a replaceable insulin cartridge, insert a new insulin cartridge before injecting. Each insulin cartridge contains around 300 international units of insulin. Remove the insulin cartridge from the insulin pen only when it is empty. Insert the cartridge into the cartridge holder, then screw the cartridge holder into a pen body tightly until you hear a click sound. For disposable pens, you will only need to change the needles and dispose the pen after it is empty. Remove the protective seal of a needle, then screw a new needle onto the pen device. Remove the outer cap and inner caps, discard the inner cap and keep the outer cap. Prime insulin pen device with the needle pointing upwards. To prime the newly opened insulin cartridge, dial 2 units and hold the insulin with the needle upwards. Flick the cartridge holder gently. For in-use insulin, dial only 1 unit. Press the dose button. Check insulin squirts to the needle top. Observe a fine stream of insulin from the tip before each injection. A new cartridge may need to be primed several times to get a stream of insulin. Dial the appropriate dose for injection by turning the dosage knob. If over the dial, dial backwards. Hold the insulin pen firmly. Insert a pen needle into the skin at 90 degrees. It should be 2 inches from the navel. Press the dose button completely until the figure in the dose window returns to 0. This is to ensure full dose delivery and prevent insulin leakage. Recap the used pen needle using the outer cap. And it is very important to inject your insulin at the correct timing and store it properly to ensure its effectiveness.